loving today's video, guys. I've got probably one of the toughest ones I've done for a long time. I did kind of hint at this last week. This actually took 3 attempts. Now, it's rare that I get people back 3 times, maybe twice every so often, but 3 was a bit more unheard of for me. So this was a lovely guy, and he came through, but he was absolutely chock-a-block on both sides. Never had wax removal done before, so you want to sit back and relax for this one, guys. We're in here for 17 minutes altogether, but really lovely chap, really struggling with his hearing. And you can see I'm working literally right at the entrance to the canal here, so really kind of right there, and it's a thick old plug, this one. I tried a little bit of suction, but the suction didn't really seem to make much of a difference. So I'm going in here now with clearest, just to get over the top. Now, at the moment, we're working right where those little tiny hairs are at the entrance to the canal. As you can see, in a second, once I clear a little bit further, there's a bit more space for the endoscope to get in, so you'll see a little bit further in. But look at the colour of this wax. This is a much darker coloured wax. So this is quite an old wax. It's kind of been in here a little while. And at the moment, I'm trying to chip off a lot of this plug, and I was hoping to try and get a little bit of purchase, but you can see just, even though I'm putting a bit of pressure on the tool, you've got to be mindful you don't put too much pressure on, because you don't want it to be uncomfortable for the patient. Because if you've got a harder plug, which is what this one is, if you put pressure on the top of the plug, it instantly transfers to the base, and that then just really kind of presses on the bottom of the canal wall. So I'm trying to put enough pressure on that we can dig into the wax, but not enough that it causes discomfort for the patient. So I've cleared the top section. I've kind of taken the surface, the top, I'd say probably about the top third to a half of the wax plug, certainly at the front end of it anyway, off. And now I'm opting to use a little bit of suction, so that, well, once I've broken that away, this plug should start getting a little bit of movement to it. But what you can see is, as I'm lifting this wax plug, I'm detaching it from the surface of the canal wall. It's just not letting go. It's just really firmly attached, which is unusual. Once you unstick that front section of a plug, normally you get it becomes a little bit more mobile. It wants to detach from the surface. So I've put some olive oil in here thinking, well, maybe it's just got a little bit of one side of it maybe is a little bit stuck, and with a bit of oil, we can work that underneath the plug, get it detached from the canal wall and let it pull away. And you can see it's not really having any of it. As much as I'm moving this, I can see the front end is moving. But when you feel it, it's difficult to see on the screen, but you kind of feel there's no forward momentum. It just feels like it's kind of side to side movements, but nothing really pulling forwards. Look at that, just starting to detach. While this is a longer one, guys, I've got to tell you a couple of different things. I'm actually away for a couple of weeks coming up, and obviously I'm the only one here out of all the Audiology team that sort of edits the videos and gets everything ready. So there'll be members videos only going out over the next couple of weeks. Just so you know, that's going to happen. We're okay for next week. I think it's the week after that's going to start from, and the week after that probably. So just members only videos going out for those couple of weeks while I'm on leave, and then things will go back to normal when I'm back. As far as members videos, guys, we are going to have a little bit of a revamp on the memberships when I get back from my holidays. That's like that plug, nice chunky plug there. Oof, you can see it's deep. I will explain a little bit more about the revamped membership when I come back from my holidays. I didn't want to start it before I went because there wasn't really much point. I needed time to get everything ready for you guys. I won't tell you anything more about that until a bit later on as well. I am kind of conscious that I have kind of not being kind of as invested in bits on the channel as I normally have been, just because we're super duper busy here at the moment, and I'm finding it difficult to try and juggle time for everything, and obviously, you know, kind of keep up with my clinical stuff as well. So that will change when I get back from my holidays as well. I'm using this as a bit of a kind of a reset, a restart. So we will get back there, I promise, guys. But yeah, bear with us on that one. It's a work in progress. I will tell you about that a bit later on. Now, what we've got with this one, going back to my lovely patient, we've got this really deep, old, solid plug. And it's that solid. It's been here that long. You know, we talk about this epithelial migration, we say about the movement of the skin down the canal. And what we've got here is, as that skin's trying to move down the canal, it's actually starting to wrap just around the edges, but just wrap around the edge of this plug. Now, that forms a really good seal inside the ear canal. And what happens here which you'll see in a second. I'll explain a little bit with this one. But this lovely guy, when I break the seal, when I start to pull this skin away from this top corner here, there, what happens at this point now is suddenly now the patient's got all this cold air that's rushing into the ear canal, and he's got this kind of lovely warmed up air that's sitting right behind the wax plug, sandwiched up between the wax plug and the eardrum. So what's happened is where I've opened that up, the cold air rushed in and the patient felt really giddy, okay? And I mean really giddy. We stop what we're doing, but in extreme cases, you can get patients and they will pass out. And this guy started, you could see he was starting to flake just a little bit. He just kind of wasn't with me for a couple of seconds. It passes very quickly, but we stay with him, just reassure everybody. But basically he started to feel really faint. So we stopped what we did and we stopped the procedure at that point. So at this point now, the patient's gone away and they've used some sodium bicarbonate just to soften this very, very deep plug we've got here. So using a bit of bicarb for about a week and come back in. So this is his second visit. Now bear in mind, I haven't actually attempted the other ear yet because the last thing we wanted to do was make that poor gent feel any more dizzy than he already did. So he's used the bicarb drops, and the bicarbs are it's a bit more of an aggressive wax softener than the olive oil. So it's designed to sort of bubble and react with the wax, and it forms lots of little air bubbles. And what that does, it tends to sort of lift off the canal. So when somebody uses it, they get a lot of crackling. If you're watching this in the US, you kind of, what's it, Debrox, I think it's called over there, does a similar job, but that's a peroxide base. If you're watching this in the UK, if you've ever used Otex, very kind of similar, that's a little bit more aggressive, that's a peroxide drop, but it fizzes when it goes into the ear, and that's what helps to lift the plug. But it also turns it very, very mushy. The good thing is it's worked really, really well, and while I'm doing this, I'm chatting with my gent, just saying, are you doing okay? If you feel any kind of lightheadedness, any giddiness, anything like that, you let me know straight away. And in fairness, for the remainder of the appointments, didn't get it again. It was just that one, I think, where it just been warmed up in there. I think it just really kind of had this caloric effect. So while we're doing this, I might as well explain what that is. So your caloric effect is basically, if you imagine that the balance system inside the ears is fluid filled, okay? And your body's maintained at a really pretty steady temperature. So the fluid in that space stays at a kind of certain viscosity then, because it's at a certain temperature. If we make that middle ear space, or the air in the middle ear space, drop in temperature, what happens is that fluid becomes thicker, okay? So as it cools, and if you warm it up, as in the same way, it becomes much runnier, so it moves a lot quicker inside the balance system. So what had happened with the caloric effect is where they cooled, it thickened on one side but not the other, so your brain was getting competing information about whether you're moving quickly or slowly, and it makes you feel really giddy. It makes your eyes flick, so you start to see nystagmus, and sometimes in extreme cases, especially if it happens very quickly, like my gent, you can look and they start to become quite vacant and they can pass out, okay? So it's something to be aware of when you're doing wax removal as well. It's actually quite scary the first time you ever see it. It's you think, oh my goodness, what's happened? But you can see just how deep that plug was, right down against the eardrum. You've still got the staining on the eardrum where that plug was actually sitting against the drum, but lovely and clear on that side. So this is now my first attempt on the other ear, and very, very similar story on this side. Very thick plug, very kind of full ear canal on this one as well. And the entrance slightly narrower. Now you'll see the little hairs in there because we have to work a little bit closer to the wax, so the endoscopes had to go in a little bit further, which is what you can see here. So we're just going to start to sort of maneuver this down, pull an edge. There you go, you can see I'm really trying to work this plug. Like I did on the other side, detaching from the edges first. There you go, it's starting to move. Starting to go this way. Don't forget, guys, as well, we post 3 times a week on social media as well, so you get to look at these videos 3 times per week. We also post 2 members only videos, so if you become a member of the channel, you get to see even more videos every single week as well. Okay, so that's coming up as well as some nifty little badges. I've seen a couple of them now. You can see them pop up in the comment section as well, so you can identify who's a member of the channel and who's not. So it comes up on there. So we're just trying to pull this. A lot of hair embedded in this one as well. You can see a really kind of hair-filled plug, but it does seem to be moving slightly better than the first ear canal did on the first visit. I'm really working all edges. just trying to get this out. Not really kind of, same as the first ear canal. I've got the side to side momentum. I'm just not getting that kind of pull forwards on here at all. So I'm aiming for the suction at the top. The view isn't brilliant because of where I'm sat with the endoscope, which is why I'm a little bit reluctant at the moment to go in with something like a curette. It's because you kind of, I'm a little bit kind of hesitant to get over the top. I'm really hoping this is going to start to pull soon. You can see a gap formed on that top right corner there. So what I'm trying to do is pull from one side to the other, just trying to chip away at the edges and then pull the plug into that gap, just move it away. He just does not want to budge though, does he? You can really see it just does not want to move. Oh, there we go. You can see a little bit of what I was really hoping, I was thinking, right, great. I've got that bit of momentum, that forward movement I needed to see. I'm holding on to this wax and really kind of working this. Oil's gone in now because I've got this plug moving. There we go. You can see now we've got that plug going. And I'm thinking, great, this is so much easier now. We've got it all out, because I really was at this point thinking, I don't know if I'm going to get this plug out. I don't have to get the gem back in again. I've got the plug moving. So now I've switched up to a curette, just to get at the remainder of the canal. You can see quite a narrow sort of entrance. We had this big old chunky plug that was quite a long old plug as well, and then we've got this little much smaller entrance to the canal, so it just wouldn't pull through, which is why which is why I used the curette there to pull the main bulk of it through. And then I spot this, that deeper, exactly the same as the other side, that deeper section, which is what's been holding the plug in, and it is rock solid, absolutely solid. I'm trying my best to pull this, and I'm thinking, well, that's okay, you know, the front section moved, but this is just so firmly wedged, like the other side, with this kind of skin wrapping on it as well. You know, really, really firmly wedged down in here. Little bit too deep, really, to use something like a curette. I'm just trying to pull the edge here. You can see I'm thinking, right, I've got some soft pieces. Just break little bits off, you know, hold a bit of suction there. Pull from this top corner. Really just not budging there at all. I'm thinking, okay, is it this left-hand side that's holding everything in? Is this what's kind of where it's still adhered to the canal wall? So I'm starting to pull on some of these places. Now what we've got here, because we've got this very, very deep section and we've got this kind of skin wrapping it, it's a really well stuck plug. The patient, when I started to pull, said, oh, that, you know, that's starting to feel a little bit uncomfortable. Now, rather than push it at that point, I don't see the point. I'd rather have the patient back in, you know, soften for a little bit longer. It worked well on the other side. So patients done exactly, so this is actually now the third visit for this patient. This is third time lucky here. So you can see the difference using a little bit of oil, because what you've got to remember is when we're softening a plug, the drop you're using is going to soften what it comes into contact with. So where we had this huge kind of plug that was really jammed in there, the very back section is dry, it's not got any drops on it. So when we get to that point, everything in front of that softened a little bit. That back section hasn't softened at all. So by using the oil now, sodium bicarb drops, which is what we've done here. So the patient already had the drops, so we're gonna just start to pull this. You can see a little bit of sort of dead skin coming away on the left-hand side, and that's what's been anchoring this into place. Sorry about the sort of fuzziness of it. It's just where the ear canal was so well, the drops were so well used in the canal. Every time I push the endoscope in, it just smears, the lens just goes up against those little hairs and just passes over it. So you end up with this kind of little bit more fuzzy kind of look to it. So I have cleaned it off. We're going back in again now, trying to get to that very deep section, but look at that, it just doesn't want to go. You can actually see where the drops have penetrated down the side of this as well. It's not there yet. It's starting to come away. It's really, you know, look at it though, it's kind of peeling the surface layers of wax off. It's not really pulling that much deeper section. So let's start with the top left, pull across to the right now. Let's see if we can detach this. It really just does not want to budge a minute. Here we go, it's almost there. Bit more, you can see the plugs here starting to turn, and sometimes that can work really well, because if you can turn it far enough, you can get a grip on that kind of slightly softer, smoother skin. That's really hard to say, all right, on the side of that plug, and that's going to help you to bring this forwards. That's nearly there. Oh, it's going, it's going, it's going. There you go. Managed to turn it and pull it down the canal at the same time. So now you need to just get this out of the canal, because this is quite a narrow entrance to the canal here. Now, a couple of people might be saying, well, you know, I know it was too deep to get a tool in there, but could you not irrigate? The reason, because somebody's bound to ask the question in the comments, the reason I didn't irrigate this one is when you irrigate someone, they are a little bit more likely to suffer with the caloric effect. If that temperature is just even slightly off, just by a degree, or even probably less than that, it's going to cause people to get really, really giddy. Now, when you're using microsuction, the only sort of temperature transference really is from the air. So as soon as you stop suctioning, the canal wall will start to warm straight away with your blood supply. When you're using irrigation, what you've got is a layer of cold or warm water that's still sitting in the canal. So it takes a little bit longer to bring the temperature back up because the water's still in the canal, and that's what causes the issue. So you can see now much clearer. And the patient actually said to me after this second, you know, after the first video, he said, I'm hearing a lot better on this side, but this was actually his better of the two ears. So this is the one he wasn't having quite so much difficulty with. And you can see there, he, you know, much, much clearer, and patient hearing so much better as well. Well, guys, thank you very much for watching that video today. No real shot at the end, because a lot of that just got sucked straight up in the machine. If you do like the videos, like I said, if you could like, heart, share, follow, and subscribe for me, that would be fantastic. It really helps the channel. And if you could also consider becoming members. You might as well, you know, like I said, there are changes that come in, so keep your eye out for that one. And until next time, guys, as always, take care of yourselves, take care of your ears, and take care of one another. I'll see you for the next video. Bye, everybody.